Thank you. Dr. Luke Evans.
Madam Deputy Speaker, may I take this opportunity to thank all the constituents in my constituency who followed the rules when Leicestershire was being threatened with a lockdown, and through their good dedication and following the rules, we managed to avoid it for now. During that threat of lockdown, one of the key messages I brought to this House was the importance of making sure that two key messages get through. Where's the affected area and the measures that come into place? So I'm really pleased to hear today that we have a simplification and a tiered-based system that will allow our constituents to understand that. With a postcode checker as well, it's even better. Now, that was built, and I fed into, the review led by Dame Mary Nay. And she's produced a document on good practice for areas going into lockdown. And I suggest members have a look at that, because you can hold the government to account by the very nature of what's written in that document. And I was pleased to hear yesterday, and I repeat it again today, that the government acknowledges the difficulties of balancing health and the economy. Because it is a simple temptation to say, let's just put the generations, protect the shielded. But of course, the evidence shows that you can't do that. That generational spread does happen, and that's when the threat comes to our elderly and our shielded. What's happened this time is we've got a more nuanced response from the government, and I welcome that. This is good medicine to change as things progress. But what I want to focus on is the future. There are some short-term suggestions that I have for government to make sure we are clear with our signage about indicative dates, changes and accountability. The principles behind the decisions we take. So that when you say to someone, why can't I sing? You tell them, well, singing transmits it 4 times further. It becomes obvious how to interpret the guidelines. We want certainty for sectors, be it the wedding industry, be it events, be it the aerospace industry or travel industry. Be certain exactly what's going to be happening for them on a guided point. They welcome timetables, they understand if things move, but at least a clear direction is important. I welcome the aim for a vaccine, but until we get there, I agree, a plan B would be useful. We've talked about near-patient testing, and I've raised those questions in this House. Could it be in the future that before you come to speak to the Chamber, you have a 20-minute saliva test, found to be negative, and then come and carry on your day-to-day life? Until we get there, I'd urge the government to read the Health Care Select Committee's recommendations on dealing with non-COVID sides. At the end of the day, health teaches us to help those who can't and empower those who can, and that should be the message the government takes forward.